I'm Lee Weinstein, and I'm going to talk to you in this video about the nature of bruxism. Bruxism is the medical term for teeth grinding and clenching. Bruxism is the source of most TMJ pain and many migraines. First, I want to speak out against a myth that's used in marketing many expensive dental services. The myth is that bruxism is caused by misalignment between your upper and lower teeth. Dentists refer to this as occlusal misalignment. There are research studies that have shown no correlation between bruxism and occlusal misalignment, and the National Institutes of Health warns on their TMJ webpage that no irreversible dental procedure, such as occlusal realignment, has ever been shown to reliably treat TMJ disorder or bruxism. With that myth set aside, let's take a look at the nature of bruxism. The cause of bruxism is different during its initial phase than it is later on if bruxism becomes established as a habit. Bruxism usually starts because of something that puts stress on the mind or body. In the mental realm, common causes for bruxism to start up include divorce, loss of a job, death or illness of a loved one, or any similarly stressful event. In the physical realm, common causes for bruxism to start up include serious illness or surgery, a traumatic event such as an assault or a car accident, or the body's reaction to a drug or food, such as an allergic reaction. So bruxism usually starts because of some circumstances we're going through. But once bruxism becomes a habit, it's more of an addiction than a reaction to circumstances. The brain becomes addicted to the sensation it gets from the roots of the teeth when we clench or grind. This addiction often strengthens itself while we sleep. As you might know from other addictions such as smoking, drinking, or overeating, addictions, once established, usually require a long-term approach to treat because the problem has become wired into the neural pathways of our mind. Unlike addictions such as smoking, drinking, or overeating, which require supplies such as cigarettes, alcohol, or food, the only thing the bruxism addiction requires is you. And what makes it even more challenging is that the addictive behavior happens while you're asleep. Today, the most predictably effective way to guide yourself out of addictive habitual bruxism is the SleepGuard biofeedback headband.